As we grow older, our bodies change in subtle ways. Some of these changes are normal. Wrinkles appear, hair turns gray, joints feel stiffer. But other changes can be signs of dangerous health problems hiding in plain sight. These are what we call silent killers, diseases that develop quietly, without obvious symptoms, until it's too late. In this audio, we'll uncover the most dangerous and often overlooked diseases affecting older adults. We'll talk about what they are, why they're so deadly, and what you can do to protect yourself or your loved ones. Stay tuned. Some of these might surprise you. 1. Hypertension, the pressure you can't feel. High blood pressure is called the silent killer for a reason. You can live with dangerously high blood pressure for years and not feel a single symptom. Meanwhile, it's quietly damaging your arteries, straining your heart, and increasing your risk of heart attack, stroke, and kidney failure. Why it's dangerous in the elderly. As we age, our blood vessels naturally stiffen. This makes high blood pressure more common and more harmful in older adults. Warning signs, often none. Sometimes headaches, dizziness, or blurred vision, but these usually come late. Prevention and management. Regular blood pressure checks, reducing salt, maintaining a healthy weight, exercising, and taking prescribed medications if needed. 2. Type 2 diabetes. Sugar's secret damage. Diabetes often creeps in silently, especially in seniors. It can take years before symptoms like thirst, frequent urination, or fatigue appear. By then, damage to the heart, eyes, kidneys, and nerves may already have begun. Why it's dangerous in the elderly. Older adults may confuse symptoms of diabetes with just aging, tiredness, vision changes, slow wound healing, and ignore them. Warning signs, often none at first. Later, increased thirst, hunger, unexplained weight loss, and tingling in the feet. Prevention and management. Limit sugary foods and refined carbs, stay active, maintain a healthy weight, and get regular blood sugar checks. 3. Chronic kidney disease. Failing filters. Your kidneys work silently, filtering waste from your blood. In the elderly, years of wear, high blood pressure, and diabetes can damage them without noticeable symptoms, until they are barely functioning. Why it's dangerous in the elderly. Kidney damage worsens gradually, and symptoms like swelling, fatigue, and nausea appear only in advanced stages. Warning signs, none early on. Late signs include ankle swelling, muscle cramps, and changes in urination. Prevention and management. Manage blood pressure and blood sugar, drink enough water, and avoid excessive painkiller use. 4. Osteoporosis, the bone thief. Osteoporosis weakens bones silently. You don't feel your bones becoming brittle until a minor fall leads to a fracture. Hip fractures in the elderly can be life-threatening due to complications. Why it's dangerous in the elderly. Bone density naturally declines with age, especially in postmenopausal women. Warning signs, usually none until a fracture occurs. Prevention and management. Eat calcium and vitamin D-rich foods, do weight-bearing exercises, and get bone density scans. 5. Cancer, the quiet growth. Many cancers in older adults, like colon, prostate, or ovarian cancer, can grow silently for years before detection. By the time symptoms show, the cancer may have already spread. Why it's dangerous in the elderly. Routine screening rates often drop with age, and vague symptoms can be mistaken for minor health issues. Warning signs, unexplained weight loss, persistent fatigue, unusual lumps, changes in bowel habits. Prevention and management. Don't skip screenings, colonoscopies, mammograms, prostate checks, even in later life. 6. Chronic obstructive pulmonary disease, COPD, breath by breath. COPD develops slowly, often mistaken for just getting older or being out of shape. By the time breathing difficulties become severe, significant lung damage has already occurred. Why it's dangerous in the elderly. Damage from smoking, pollution, or untreated asthma adds up over decades. Warning signs, shortness of breath, chronic cough, wheezing. Prevention and management. Avoid smoking, get regular lung function tests, and use prescribed inhalers. 7. Atrial fibrillation, the irregular rhythm. This is an abnormal heart rhythm that can come and go without symptoms, but it greatly increases the risk of stroke. Why it's dangerous in the elderly. Age-related changes in the heart make arrhythmias more likely. Warning signs: sometimes none. Occasionally palpitations, weakness, or lightheadedness. Prevention and management. Routine heart checkups, heart-healthy diet, and medications to control rhythm and prevent clots. 8. Depression, the silent emotional struggle. Depression is often dismissed as just part of aging, but it's not. It can seriously affect physical health, cognitive ability, and even lifespan. Why it's dangerous in the elderly. It's linked to higher risks of heart disease, weakened immunity, and suicide. Warning signs: withdrawal from activities, changes in appetite or sleep, feelings of hopelessness. Prevention and management. Open conversations, counseling, social connection, and in some cases, medication. 9. Dementia, the stealthy mind thief. Dementia, including Alzheimer's disease, develops gradually. At first, it may seem like mild forgetfulness, but over time, it robs independence and quality of life. Why it's dangerous in the elderly. Early symptoms are easy to miss, and delayed diagnosis limits treatment options. Warning signs: memory loss affecting daily life, confusion, difficulty following conversations. Prevention and management. Stay mentally active, eat a brain-healthy diet, manage cardiovascular health. 10. Peripheral artery disease, the blocked path. PAD narrows blood vessels in the legs, reducing blood flow. Many elderly people feel no symptoms until pain or ulcers develop. By then, the risk of amputation is high. Why it's dangerous in the elderly. It's closely linked to heart attack and stroke risk. Warning signs: leg pain when walking, cold feet, slow healing wounds. Prevention and management. Quit smoking, stay active, manage blood pressure and cholesterol. Final thoughts. Silent killers don't come with loud alarms. That's why awareness, regular checkups, and healthy living are so important as we age. Catching these diseases early can mean the difference between living well into your golden years or facing serious complications. If you or a loved one is over 60, make prevention and screening a priority. Remember, the quietest threats are often the most dangerous. Don't forget to like, subscribe, and follow. Thank you and stay safe.